We heard the earlier guest say, if I don't make the elite soccer team in the suburb, then maybe I don't have an outlet to kind of get out and get active. Is that something you're seeing too?
Absolutely. I think that what we're seeing is communities starting to come together in some really creative ways to look at this problem, not for a single silver bullet, but really kind of creatively looking at a number of factors. So I think communities, to the point that you're raising about certain kids making elite teams, is really making sure that their access to programs and after school programs, including a lot of movement towards what we call joint use agreement or shared use agreement, that are keeping schools open after hours so that kids and families have safe places to play competitive games in safe ways that just make it more accessible for everybody in the community to play a role.
Where are you seeing some positive movement on this issue?
Yeah. Well, some of the communities that we've been kind of working and learning from recently, one of them is Birmingham, Alabama, which has had some really significant health disparities and some real challenges with childhood obesity and adult obesity and overweight. With help of local community resources as well as the Centers for Disease Control and Robert Wood Johnson Foundation, they've really taken on some pretty massive strategies, including kind of fundamentally changing what's offered for food inside of their schools, changing the procurement policies for how they access and what types of foods they buy and where they buy those, so that there's the healthy foods that Marilyn and others were addressing earlier on, making sure that there are safe routes to schools, good crosswalks, so how kids get to school in really safe ways, after school programs, limiting screen time, limiting the types of unhealthy foods and sugar sweetened beverages. So looking at a comprehensive way, almost the surround sound, so that as youth and family are getting their ways to school, that there's healthy choices all the way along. Kaiser Permanente sometimes calls this, how much dose does it take to actually literally change the behavior of family and kids? And so communities like Birmingham are really looking at how they increase the dose in all of their settings to ultimately tip and change behaviors.
So how did they do that? Did it get so bad that people said, we've got to do something about this, or was there some sort of leadership? Well, you mentioned a couple of big names there in terms of funding. Did someone come in and change their world for them? How did it happen?
Yeah, I think it's a great question, and I think it happens a little bit differently for every community. Nashville is another community, just to answer the question with a different example, where they definitely have been tracking the trends just like everybody else in the country, that there's a huge obesity problem. But they started to see it as a frame, not just as an obesity challenge, but they started to see that this was really driving some of their challenges around academic performance, some of the achievement gap within their schools. They're starting to see it as problems with their transportation systems. Hospitals that were getting involved in Nashville were seeing this as an issue, since about 75% of what goes through hospitals these days has to do with chronic disease and how to manage those. They started seeing this as an opportunity to manage costs. So all these different stakeholders started to come together and see some shared interests and actually some common solutions for meeting some of those shared interests, even with slightly different frames. And in the case of Nashville, we have Mayor Dean, who's made it one of his primary issues to really rally around the business community, hospitals, Vanderbilt University, and a lot of local not-for-profits, including the United Ways and YMCAs, all working towards the common solutions, all using similar metrics, and really comparing notes around what's working, what's not.
Some unique partnerships there.